Hari Om. I am Dr. Vidya Deshpande from Yoga Vidya Gurukul, YogaPoint.com, Nasik, Maharashtra, India. I like to share some gynecological problems with you. So, we must know the anatomy and physiology of female genital system. This is the side view of female genital system. The uterus is situated in between the bladder and rectum in normal position known as anteroverted position. See, the fallopian tube is there with ovary, cervix, then vagina. The uterus is tied with ligament. If the strength of ligament is reduced, then the uterus position will be changed. Many times it come downwards, means it change a normal position, and this situation is known as prolapse of uterus. The uterus is full of blood. The inner layer which you are looking, that is reddish color, that layer is known as endometrium. The menses means the shedding of that endometrium. When the endometrium started shedding, then the bleeding start, known as menses. The muscle of the uterus started contracting and relaxing during menstrual cycle or during the menses. It gives the pressure on bladder and rectum. So many times the patient complain about constipation or loose motion, the frequency of maturation or retention of urine before menses. Because of constipation and weakness of ligament or weakness of uterine muscle, the pain is occur, known as dysmenorrhea. You also see near the vagina there are two glands known as Bartholin glands, which keep the vagina moisturized, and also it helps to kill the bacteria. Now we will see what is a menstrual cycle. Averagely, it is of 28 days or 25 to 35 days. When the girl reaches her maturity, that is around age of 12 to 14, first menses start, is known as menarche. Nowadays, due to modern lifestyle, the menarche start at the age of 8 or 9. That is also normal. Then what is physiology of menstrual cycle? We will see. In our endocrine system, pituitary is a master gland which is situated in brain just below the hypothalamus. This gland secrete FSH and LH, that is follicular stimulating hormone and luteinizing hormone. It stimulates ovary. Then ovary release the graphene follicles which is mature, the one follicle in each month. Due to estrogen, on the 14th day, the 14th day of cycle, the mature egg is released from the follicle. That cover is known as corpus luteum, which secretes progesterone. If the conception is there, then the progesterone level increases and help to grow the embryo. If the conception is not occur, then the progesterone level reduces. On the 28th day of the cycle, the endometrium started shedding, known as menses. This repeated again after 28 days, known as menstrual cycle. When this cycle come 8 days before or 8 days late, then also it's a normal menstrual cycle. But if the cycle came 8 days before in this month, 8 days late in next month, again 8 days before in next month, then it's irregular menses. This complaint starts when the hormonal imbalance is there. The hormonal imbalance occurs because of stress. Stress is one of the cause of hormonal imbalance. Because of the stress, adrenaline gland stimulate and secretes adrenaline. These hormones disturb the other hormones and irregular menses starts. In this picture you see first to 13 is the follicular phase. That is formation of graphene follicle. 14th day is ovulation period. The egg mature. 15 to 28 day is the luteal phase. Next you see that is body temperature. The body temperature is start rising during ovulation and luteal phase. Next you see the hormonal levels FSH and LH. The FSH is more in first 14 days. LH is more in 14 to 28 days. Estrogen, estrogen is more in first 14 days and then reduces. And progesterone less in first 14 days and then increase in 14 to 28 days. And after 28 or just during 28 it goes reducing, that it's drop. Next you say see the ovarian cycle. In that you see the ovum come out from the graphene follicle on the 14th day, and then the uterine cycle, that is the menses start. That time the progesterone also drop. All of you know what is the normal menstrual cycle. Now we will see some common gynecological problems. First is premenstrual syndrome. This is a physical or mental problem which occur before menses. Second is a dysmenorrhea, is a painful menses. The pain start before and during menses, and after menstrual cycle or after menses, it the pain stop. Amenorrhea is a no period, at least 3 months. Menorrhagia is a heavy bleeding, heavy period. Then PCOD, polycystic ovarian disease. Irregular menses. The menses come after 15 days or after 2 months, after 3 months, like this. Menarche and menopause. Menarche is the first menses come in the female's life, and the menopause is the last menses in the female life. Infertility. The conception is not there after trying for 1 year. Uterine prolapse that I have shown you in second slide, that the uterus come downward. Many time it comes out from vagina. There are grade first degree, second degree, third degree. Then endometriosis. Endometriosis is the inner lining of the uterus is increased and grow outside the uterus. Then leukorrhea. Leukorrhea is a white discharge, excessive white discharge from vagina. Then candid infection, it is a fungal infection. Then incontinence is a weakness of pelvic floor. Urinary infection, there is a UTI, you said, there is urinary tract infection. Then breast lumps or breast cancer and cervical cancer. We will see all this in detail in our next slide. See some common causes of gynecological problem. Stress is the cause of hormonal imbalance, mostly the hypothyroidism or hyperthyroidism. Stress of family, stress of work, business, stress of study or career, it causes hormonal imbalance and many other diseases. Anxiety is another cause which occurs heavy bleeding, irregular menses, etc. Obesity is the cause of menstrual problem, that is infertility, PCOD problem, again irregular menses. Then lifestyle. If the lifestyle is wrong, sleeping time, lunch time, dinner time is wrong, then it occurs obesity, PCOD problem, diabetes, cancer, heart problem. Poor diet means no vitamins, no minerals, less iron content food. This occur amenorrhea, scanty menses, heavy bleeding, premenstrual syndrome. Then disturbed relationship. Thyroid problems is occur due to disturbed relationship. Amenorrhea, many time cancer, breast cancer or cervix cancer. Hormonal imbalance is the most of the disease occurs due to hormonal imbalance, that is the diabetes, menstrual problem, obesity, anxiety, depression, etc. Weakness in the pelvic region is causes habitual abortions, prolapse means prolapse of uterus. Then low pran or low vitality. It occurs amenorrhea, premenstrual syndrome, scanty menses, leukorrhea. Relationship with menstrual cycle is a lack of awareness. Many ladies they don't know the phases, the safe period, and therefore many problems occur in their life. Causes of hormonal imbalance. First is a faulty lifestyle. Many ladies they don't know when to go for sleep. That is, sleeping late night is one of the cause of hormonal imbalance. Not only sleep, but also what they think, how they behavior, what they work, all these things come in faulty lifestyle, which is the one of the cause of hormonal imbalance. Second is obesity. Those who are not doing any exercise, working for 18 hours, but only in sitting position, is again the one of the cause of hormonal imbalance. Then stress, which disturb the hypothalamus, which is the uh, part of brain which control the all the endocrine system. First, for pituitary, the control of hypothalamus is on pituitary, which is the master gland of the endocrine system. When the ladies is in stress, the hypothalamus disturb. Obviously, it disturb to pituitary, and pituitary disturb to other endocrine glands. Then ovarian disease, that is polycystic ovarian disease, is occur because of hormonal imbalance. If the tumor is there, again the hormonal imbalance occur. Endometriosis is the one of the cause of obesity and also hormonal imbalance. Pituitary disease, I explain you, because pituitary is the master gland and that gland control other endocrine system. If the pituitary is disturbed, then follicular stimulating hormone, luteinizing hormone, all hormones disturb, and they disturb the other glands. The infections, tuberculosis, and other infections is also occur because of many time some medicine, and they disturb the hormonal imbalance. Congenital defects, this problem occur from birth. For example, juvenile diabetes, type 1 diabetes is occur because of the pancreas. The pancreas is not, there is no beta cells, alpha cells from birth. Therefore, the juvenile diabetes occur. No insulin secretion. Many times there is no ovaries since birth. That is a congenital defect. Therefore, no estrogen, no progesterone, and their life is disturbed because of endocrine system. Now we will see the gynecological problem one by one in detail. Premenstrual syndrome. In this, the ladies is always irritable. The mental tension is there, unhappy. These are the main symptoms. Other, the stress is there, anxiety, insomnia, headache, fatigue, Mood is always swing because of hormonal imbalance. She is very sensitive, decreased libido, bloating of abdomen, cramps, constipation, diarrhea, alternate. Breast is tender or swelling is there, acne is there. These all symptoms is there before menses. And the menses start, the bleeding is start, slowly all these symptoms vanishes. After 4 to 5 days, there is no a single complaint. This is a premenstrual syndrome. Before menses, all these symptoms are there. Therefore, we say that is a premenstrual syndrome. And the cause is first is a diet, that is fast food, junk food, very spicy food, or we say that is Rajas food, caffeine, family history, any family background is disturbed, depression is there because of again any reason, family matter or in job, stress, hormonal imbalance. All these are the cause of premenstrual syndrome. Dysmenorrhea is a painful menses. There is severe pain in the lower abdomen or backache, pain in thighs during menses. But after bleeding, after 4 days, the patient feel better. All the complaints are vanishes. The primary cause of dysmenorrhea is unknown, but it is because of weakness of genital system or muscles, the weakness of uterus, uterine muscles, narrowing of the cervix. This is a primary cause. In secondary cause, it is because of pelvic congestion, endometriosis, adenomyosis, fibroid, PCOD is the secondary cause. Amenorrhea is a no period, at least 3 months. Menorrhagia is a heavy period, that is heavy bleeding, you say. The bleeding at least 5 to 15 days, many time 1 month. Bleeding is more. The blood is 80 to 100 ml in one period. The lady want to change the pad 2 to 3 times a day. At a time she want to use two pad because of heavy flow is a menorrhagia. And the cause is again endometriosis, adenomyosis, fibroid, PCOD. Then irregular menstruation. The menses come after 15 days, 1 month, 2 months, 1 month before, like this. It is because of hormonal imbalance, stress, traveling, and also in menopause. PCOD, polycystic ovarian disease. In India, 10 to 30% of women is suffering from PCOD. In this, the grapes like cyst attached to the ovaries and it causes less or more bleeding or irregular menstrual cycle, increase the androgens, insulin resistance, obesity, infertility. This disease is very common nowadays. In this, you must reduce the weight. It's a treatment. And so, control the diet, control the weight by giving yoga therapy, yogic diet. Another is uterine fibroid, benign tumor. In this, the heavy bleeding is there, bloating and abdominal discomfort, urinary frequency. If this problem is there, then only you should give the treatment. Otherwise, in menopause, it shrink. If the bleeding is more, then you give hysterectomy or medications. Many times, the naturopathy is also good in this uterine fibroid. But if there is no any symptoms, then don't give any treatment. Menarche means the menses started between 10 to 14, the age of 10 to 14. If the menarche started as earlier, means at 9 or 10 years old, the cause is obesity, no father, family conflict, cigarette smoking exposure, low birth weight, not breastfeeding. If the menarche come at 17 or 18, then you must check from gynecologist because many times there is some problems occur. If the menarche is not started at 18, then also you must go to gynecologist and check because many times the uterus is closed, the cervix is closed. Then you must do a small, you must, the doctor will advise you to do a small operation for it. Menopause, the between 40 to 60, the averagely 45 to 55 age, the 10 years is of menopause, premenopause, menopause and postmenopause. Premenopause takes 5 years at least. In this, the length of cycle changes, heavy or light bleeding, hot flashes, mood swing, insomnia, dryness, dryness of vagina, fatigue is the premenopause. In menopause, the menses not come for at least 12 months continuously. That is a menopause. The same complaints are there. And in postmenopause, again, it takes 5 years. In this, the osteoporosis, heart problem, hypertension, diabetes, obesity, hot flashes, dryness of skin, dryness of vagina, insomnia, mood swing, same complaints. And many times the complications occur in postmenopause. Uterine prolapse is occur due to the ligament which hold the uterus is loose. That is, the strength of ligament is reduces. Another cause is multiple abortions or multiple childbirth. Generally, it causes from difficulty in childbirth. In this, the uterus come down from the vagina. There are different grades in prolapse of uterus: first grade, second, third. Endometriosis. Endometrial cells grow in other areas such as the abdominal cavity, fallopian tube, ovaries. In this, there is a strong pain, infertility, fatigue, and heavy bleeding. Many times, the anemia is also there because of heavy bleeding. And possible causes is retrograde menstruation. Leukorrhea, excessive discharge, is a vaginal discharge. It's watery, yellowish, pinkish, from infectious or estrogen imbalance. May or may not be smell. Many times foul smell is also there. If there is heavy discharge, many times the diagnosis will be the cervical cancer also. So if there is heavy white discharge, please go through pap smear, then it will be diagnosed. It is because of infection also. The Bartholin gland secretes white discharge. It moisturizes the vagina, but the infection is there, then there is inflammation for Bartholin gland and the discharge will be increased. Candida is a fungal infection, very common. The complaint is itching, soreness, pain, discharge. Again, the cause is unknown. Unknown cause is everywhere in medical life. Hormonal imbalance, use of antibiotic is more. The cleansing is not good. That is unhygienic condition. Incontinence. It occurs due to multiple pregnancy or multiple abortions, weak pelvic flora due to stress. And for this, yoga is the best remedy. The Moolbandha, cages pose, these are the best yoga treatment for urinary incontinence. Then urinary infection. Frequency, the complaints are frequency in urination, then painful urination, fever, vomiting, and he feels to need pass urine but can't pass. Pain is there while passing urine, or little quantity they pass urine and then the last drops is very painful. These are the complaints, and the cause is E. coli. In 85% cases, dehydration, or if they are taking less amount of water, only half liter or 1 liter in 24 hours. In menopause women also urinary infection is there. Again, the infection is due to residual urine. And the bicarb is the best remedy for to reduce the acidity, pains, and also the flow, to increase the flow of urine. In infection, you must give antibiotics, which is helpful with yoga. Breast lump or breast cancer. In all the women, they must do mammography after age of 45 in each year. Yearly they must do the mammography to check the breast cancer. Also, the breast self examination they must do while taking shower every day. Check your breast, see the size, slowly press and see any lump is there, any tenderness is there, swelling is there, the color, the skin color is changed. Then immediate go to your doctor and take advice. The cause, the breast cancer is mostly due to genetics, that is hereditary problem, then wrong diet, wrong lifestyle, no childbirth, no breastfeeding are the reason. Then cervical cancer. Again, after age of 40 or 45, each month, each year, the woman must go for pap smear. Is the examination or investigation for vaginal cancer. It is most of the time asymptomatic. Vaginal bleeding is there. Many times white discharge is more. Pain is there. In advanced cases, we'll have the general cancer, the possibility of metastasis. In human papilloma virus, 16 to 17 are the cause in 75% of cases. Infertility is a failure to conceive within 2 years of unprotected sex. Nowadays, 1 year. Within 1 year, they started taking the treatment. Don't take immediate the hormonal treatment. Usually 40% due to female, 40% due to male, and 20% is unknown. The unknown is good for us because in unknown there is no any diagnosis, then yoga is very 100% helpful. In male, you must see the sperm count, then in female, the DNA damages, there is smoking, genetic problems, structural problems, ectopic pregnancy, PCOD, tubal blockage, endometriosis. In this, most of the cases is successfully pregnant or conceive after doing yoga therapy. Not only yoga, but diet is also important. Naturopathic treatment is also important. Thinking, behavior, all these things must be important in infertility cases. Thank you.